Now let's stay in the health sector and even in the child care sector, because for the past month, nursing mothers in Ghana have been unable to immunize their babies against measles and yellow fever. This is because there has been a shortage of the vaccines for these diseases. This is apart from the shortage of polio vaccines, which a government is grappling with at the moment. Joy News visited some health facilities to find that mothers were worried about the health of their children in face of this situation. Now, UNICEF representative Dr. Peter Bafo, however, told us this morning that payments have been made for the needed vaccines, but his outfit is yet to deliver them to Ghana.
The country. For this polio vaccine that we are talking about specifically, these are among group of vaccines that we call traditional vaccines. Government pays for those vaccines, and then UNICEF helped to get the vaccines in country. So we are not very sure probably what has caused the delay, but what we do know is that there's this report out there that vaccines, polio vaccine, has run out of stock in the country. So this information got to us, but as far as we are aware, government actually has paid for the vaccines, and UNICEF is helping to get vaccines in country.
Well, logically, I should assume, just like has been done in the past, you know the estimates, you know the numbers, and so you need to get them in place before stocks run out. Why don't we have that cycle?
Well, I think governments and the EPI team are better placed to speak about that. You know, UNICEF is not an implementer, and UNICEF directly does not give vaccines to children. We wouldn't know what is in their stock. So I think the EPI team will be in a better place to probably speak to that. Yeah.
Right. If you're in a better position, perhaps, if you are at all, to tell us what the numbers are. How many children usually annually, let's say over the last couple of years, have we been vaccinating against polio?
Yes. Generally, we are talking about close to 1 million children delivered in Ghana every year.
It means that at least it should go to about averagely 1 million children across the country.
But you know, for vaccines, when you are calculating vaccines, you also have to take into consideration that during the process of receiving vaccine, storing and administering vaccine, you could lose some vaccines, which we call wastage. So obviously, when they do calculations, they take all these things into consideration, and they are likely to procure more than this number that you are talking about. Well, I think what it means is that you have some children who may not be vaccinated on time. It doesn't mean that they will not be vaccinated at all. You know, when you are running a public health program of this nature, which is quite big, and for many years, this program has run very well, it is possible that once in a while you have a hitch here and there. And I think the most important thing is to have systems in place that can respond to this quickly. And when vaccines run short and the process are triggered to get them in quickly, what happens is that you will have children who may not receive the vaccine on time. But when vaccines come in, the program have systems to mop up and get these children vaccinated. So like I said, it looked like it's not going to be a long period of shortage anyway, because we have the assurance that the vaccines are coming in from early next week. So vaccines will come in, their systems are there to distribute them to the regions and to health facilities, and hopefully those children who did not get it on time will be mopped up for vaccination.
So from UNICEF, we can perhaps have the headline not only in our bulletins, but also, let's say, on an online.
That was Dr. Peter Bafo. He's with UNICEF. Let's go on the phone lines and speak with Gabriel Benaku from the Coalition of NGOs on Health. Welcome, sir. What do you think is the reason for the shortage of vaccines in the system? Well, hello, Mr. Benaku, can you hear me?
Yes, I can hear you.
Yes, my question was, what do you think is the reason for the shortage of vaccines in the system?
Yeah, thank you. The issue is very simple. every year Ghana has a budget for immunization. So all the commodities is already planned and is projected. And every January of every year, we already know how much we need to take care of vaccination across the country. So when the state is not responding to its obligation, that is why you can have the crisis. The reason is Ghana gets support from Gavi and other development agencies. And UNICEF is the organization that helps to bring in the vaccine and other commodities to support immunization program in Ghana. Now, the arrangement is that Gavi is supporting the government of Ghana with certain amount of money, and government of Ghana is supposed to also pay its counterpart funding to be able to have the 100% cost of vaccination. Over the last 2 years, the government of Ghana has been defaulting in its obligation of paying its counterpart funding. And so when the donor...
How much of this money is government supposed to pay?
The figure is a little above 100 million. It's about $33 million. I'm not sure of the... But the government of Ghana is supposed to pay a certain percentage, 20%. We are in a transition period, so donors are not financing immunization program 100% in Ghana. So we have to provide a counterpart funding to support what the development partners are giving so that we can have a total of what we need for immunization services. And because we've been defaulting, they also keep on delaying their counterpart funding. And recently we met the Director General of Ghana Health to draw his attention about the situation. He admitted the fact, but he assured us that as of last week, we were going to get the vaccine because the government has paid about 9.3 million for its counterpart funding for 2015. So we were expecting that by now, UNICEF should have brought the vaccine in to be able to take care of the crisis. But we are seeing that the consumers are still not in. We have not heard anything from the Ministry of Health. We think that is very unfortunate, and they must take serious steps to ensure that we get the vaccine immediately.
So, Mr. Benako, it comes back down to the fact that we don't have enough money to cover some of these payments we have to pay in the health sector.
Ghana has money. It is about leadership and commitment. As I keep on saying, over the last 2 years, I keep on talking about leadership and commitment. That is what we need. We need a policy on immunization financing in Ghana. We need immunization fund. And it's only the leadership of Ghanaians who can help.
You mean government? You mean government?
Have a proper financing of childhood immunization program in Ghana.
Right. Thank you very much, Gabriel Benako, for that. He is with the coalition of NGOs in the health sector.